Hi, my name is Kayla. I'm also known on the internet as Montessori Expat because I am a parenting educator and coach. I share on Instagram, especially tools for raising kind, capable kids with confidence and joy. I've been sensing recently that I wanted to share a little bit more about my journey with diabetes, with type 1 diabetes, and maybe even how that affects my parenting. But this video will be about my diagnosis, how I was diagnosed, and the journey to taking insulin. And it was almost 2 years ago that I was diagnosed with type 1 diabetes, and it was shocking. There was so much I didn't understand about what type 1 diabetes was, and I didn't understand how it would impact my life. I also felt like my story didn't really match the other stories that I heard out there. Mine felt different and it felt hard to actually get information that made sense. And so I was really confused for a while about what exactly my diagnosis was and what treatment should look like. So I'm going to share my story in case it helps someone else, in case someone else can relate, to help educate about type 1 diabetes and some of the signs and symptoms for being diagnosed. And I hope that this can help you if you have a family member or someone that you know, or you yourself it has been diagnosed or think you might have type 1 diabetes. Disclaimer, I am not a medical professional, so just make sure to consult your doctor before you make any decisions about your treatment. I am just the kind of person that researches something to death. So that's what I have done and am continuing to do as I discover more and more about how type 1 diabetes affects the body. And so I'm going to share my story and share some of the things that I've learned. First, I want to share some answers to some common questions I get about type 1 diabetes. And the first one is, isn't type 1 diabetes diagnosed in childhood? And I think this is what I thought as well, that type 1 diabetes is something that kids get, but actually, and I think it's increasing, it's about 62% of type 1 diabetes diagnoses that are in people 20 and older, and it's about 37% in people that are 30 and older. So that's over half of cases that are diagnosed in adulthood. And so, no, it's not just diagnosed in childhood. Adult onset type 1 is what people refer to this diagnosis as. It's also called LADA, LADA, which stands for latent autoimmune diabetes in adults, or sometimes it can be referred to as type 1.5 or 1.5. This is what I was diagnosed with when I was first diagnosed. This is what the doctor told me it could be. And honestly, I think it's actually a really confusing term. I didn't understand that type 1.5 is type 1 and that treatment is going to look like it does for type 1 and it follows the process of type 1. And so I'll get into a little bit more of how I was diagnosed, but just know that any of these terms, it's all type 1 diabetes. So what the other question that I get is, what's the difference between type 1 and type 2? So type 2 diabetes is brought on by diet and lifestyle. And I have not done a ton of research on type 2, so this is my understanding, and maybe someone else has another understanding. Feel free to put it in the comments. But my understanding is that type 2 occurs when someone is eating so much sugar and or carbohydrates that it stuns the cells in their bodies and they become insulin resistant. The cells in their bodies become insulin resistant, which means that the insulin can't get into the cells, and the insulin acts as a key to then bring glucose into the cell so that the cell can utilize the glucose. So when they're insulin resistant, the cell, that key insulin doesn't work, and the cell cannot utilize the glucose. So that means that they aren't able to metabolize the glucose in the blood, and glucose starts building up in the blood, and there's a high level of glucose in the blood. And because of that, the body actually starts producing even more insulin. And that insulin is still not used by the cells. And so you have a high level of insulin and a high level of glucose. And both of these things can actually really negatively impact the body. So to reverse these negative effects, someone with type 2 can change their diet to a low-carb diet and exercise, which exercise helps metabolize the glucose. And they can actually reverse type 2 diabetes, and they can actually teach their cells to become receptive to insulin again. So type 1 is completely different. It is an autoimmune disease, meaning that something triggers the body's immune system, and the immune system sees healthy cells as a foreign cell and attacks and kills those healthy cells. And so in this case, in the case of type 1 diabetes, the immune system identifies and targets the beta cells in the pancreas that produce insulin. So in a childhood diagnosis, this can happen pretty suddenly. And in adulthood, it can be more of a slow process of losing those beta cells. I'll get more into this process later. But when you look at blood work for someone with type 1, you're going to see high glucose levels and low amounts of insulin. And then you're also going to see autoimmune antibodies. So because people and even doctors, even family doctors still think of type 1 being a childhood disease, and because type 1 in adults can be slow progressing, it can be and is often misdiagnosed as type 2. So slow onset type 1 can have a lot of the same symptoms, initial symptoms, as type 2 if the doctor has not ordered the correct blood tests. So if you've been diagnosed with type 2, or you know someone who's been diagnosed with type 2, and you're doing everything right, you're on the medication, you're exercising, you're eating low carb, but you're still not seeing your numbers come down, your glucose levels are still really high, ask your doctor to check your C-peptide and your antibodies. So the C-peptide is the amount of insulin in your body. And if it's high, then you most likely have type 2. But if it is low or on the lower end, then there's a good chance you have type 1 diabetes, because you do not have enough insulin producing beta cells, and the antibodies will show that your immune system is attacking your beta cells. So one more thing about those insulin producing beta cells is that they don't grow back. So a lot of the cells in our body can regenerate, can grow back. Unfortunately, those beta cells in our pancreas that are producing our insulin are one of those cells that cannot grow back. Once they're dead, they cannot regenerate. So now I want to talk about the general process of type 1 diabetes progression. I am taking this from the podcast, Taking Control of Your Diabetes, which I highly recommend. It's hosted by two endocrinologists who themselves have type 1 diabetes. And I personally found this podcast really helpful when figuring out what diabetes is, what process my body is going through, and what treatment it needs. So in stage 1, your body has already started producing those autoimmune antibodies. And they think that it can often be tested for and seen, early on in the person's life. But it actually, you might not show symptoms for years and years and years. So stage 1 is when your body has those antibodies, but you have normal blood sugar and you don't have any symptoms of diabetes. Stage 2 is you start having slightly abnormal blood sugar levels, but you don't have any of those symptoms. So people usually go undiagnosed in stage 2. And then stage 3 is the clinical diagnosis of diabetes. And you're probably experiencing symptoms like unquenchable thirst, frequent urination, blurry vision, extreme tiredness, frequent hunger, possibly weight loss. Many people don't catch these symptoms quick enough, and they can develop into diabetic ketoacidosis, which is also known as DKA. And these symptoms are nausea, vomiting, and stomach pain, confusion or trouble paying attention, fruity smelling breath, dry mouth, dry or flushed skin, headache, and muscle aches. And if you or someone you know is at this point, get to the hospital ASAP. Going untreated, this can lead to death. So once you're at this point, this is serious. So now I'm going to talk a little bit about my story. And the other thing I wanted to say is that there can be a honeymoon phase in stage 3 where you actually get diagnosed, but your body's still producing some insulin, and you might even start taking insulin and be able to come off insulin because your body is making some and it's able to utilize what it has. But ultimately, what the research shows is that eventually this could take years and years and years, or it could be a quick, it could happen very quickly. Your body will kill off all of the cells and your body will no longer be able to make insulin, and insulin therapy will be needed. So now I'm going to talk about my story. So my brother was actually diagnosed with type 1 diabetes in 2020. And so I think he was 26 or 27. And it was very shocking, but our whole family kind of wrote it off because as like, oh, wow, but yeah, that makes sense. Because he had childhood cancer and had gone through chemo, and we knew that there could be side effects later. So when he was diagnosed, none of the rest of us thought that we were at any risk. We kind of just, I mean, it was very shocking, but we just attributed it to, all the things that his body had to go through as a child. So my husband and I are humanitarian aid and development workers. I've been living in the Middle East off and on since 2014. We moved to Lebanon in 2018, and both our children were born in Lebanon. And with both of my pregnancies, I had gestational diabetes. And so I, I got used to monitoring my blood sugar during my pregnancies, eating very low carb. And I was able to manage my levels pretty well without any medication. I made sure that I was eating very low carb and followed a higher protein diet, and kind of did all the right things to keep my glucose levels down. It was harder in my second pregnancy to keep my levels as low as they had been with my first. I'm not sure if that was because my body had progressed to a certain point and was, not able to break down sugars as well, or I also had a toddler while I was pregnant and, just had less energy, I think, too, to like, just do all the things that needed to be done. But anyways, I do remember that after the birth of my second child, at some point, I don't remember if it was in the hospital there after the birth or if it was at the 6-week checkup, but I remember that she tested my sugar levels and she told me that they were elevated and told me to keep an eye on it. I completely brushed that off and totally forgot about it until very recently. So then in 2021, we experienced an extremely challenging year in Lebanon. There was a lot of there was an economic crisis. There were just a lot of hard things in the project that we were working on. And yeah, personally, it was just really hard. And so we just thought we are super burned out, and I had severe fatigue. And so we needed to come back to the States and take a sabbatical. And we just attributed it to like burnout and stress and overworking. But so in February of 2022 is when we came back to the US, and it was hard to get out of bed like for months. But I have 2 small children, so staying in bed is not an option, but it was very challenging. And there were a lot of mornings where, my husband had the kids in the morning and I would sleep in a little bit, just because I was just so exhausted. I felt like I could barely function. I, was, could barely get up off the couch. I remember we did a lot of reading books because that was how I could connect with my kids, while just sitting on the couch. But this whole time just thought this is intense burnout. This is, from the extreme stress. Well, in May, all of a sudden, one day, I was driving our kids to school. We had put them in a preschool, and all of a sudden, I could not read the street signs or the license plates on the cars. My farsighted vision was so blurry that it was really shocking. And it literally felt like one day I had driven them to school and was fine, did not notice anything. The next day, everything was blurry. So my first thought was that I needed glasses, but then I realized that eyesight doesn't deteriorate that quickly. It doesn't disappear overnight. So I thought it was probably something else, but I thought, okay, let's just wait a few days to see if this is like a fluke and see if it comes back. But in that week, so it didn't get better. And that week, my symptoms peaked with excessive unquenchable thirst and waking up multiple times in the night to pee. And it sounds obvious when, talking about it and looking back, but, when you're going through something like that, you just don't think a diagnosis like this could happen to you. So, I waited like a whole week before I did anything about it. And so after about a week of experiencing these severe symptoms, but just kind of writing them off, I remember talking to my husband, and we were in the car and telling him, I think there's really something wrong with me. Like, I think this isn't just like stress. Like, I think there's something wrong. And he was like, you should probably call your brother, because some of these things really do sound like diabetes. And so that Saturday, I had taken the girls to this farmer's market with their cousins, and we all went to lunch after. And I remember I had a burger and sweet potato fries. And after I got home, I called my brother and I asked about what his symptoms were before he was diagnosed. And then I told him my symptoms, and he was like, you need to go to a pharmacy right now. You need to buy an Accu-Check, and you need to test your blood sugar. And so I did that, and my numbers were over 500. I think they were like 550 or something. I called him back the first thing, and he's like, you need to go to the hospital right now. Now, side note, I am pretty crunchy. And up until this point, I'm not saying this is, good or bad, but I had really formed some opinions about modern medicine versus, traditional Eastern medicine and more natural medicine. And to be honest, I still hold a lot of these thoughts and opinions. My kids have never had Tylenol or antibiotics, and they really never needed them. We really focus on treating, using preventative treatment and care, and making sure we're nourishing our bodies and eating the things that we need to eat to take care of our bodies. And, I understand that there are some illnesses that cannot be treated without antibiotics. And so I'm glad that we have antibiotics for if that ever does happen. And, but, up to this point, with any of the more common colds and viruses they've had, we try to use natural remedies and try and just focus on strengthening and building up the immune system. So I've also always been the type to advocate for my own health and do a lot of research before just following something that's prescribed, following, recommendations. So, you might not agree with that stance, and that's totally fine. I'm just sharing this to tell you why I decided not to go to the hospital and some of the other decisions I've made down the road. Um, and someone else might have gone to the hospital at that point, and maybe I should have. And if your numbers are high, that might be the best option for you. Um, this is just where I was at that time. So I didn't go to the hospital, but I did make an appointment with a doctor that I heard that was recommended. He was an MD. He's a practicing chiropractor, and he has worked extensively with patients with type 2 diabetes. He was actually trained by Atkins, who created the Atkins diet. And so he, was very familiar with type 2 diabetes. And so anyways, that's who I went to see. And I think because he was so familiar with type 2 diabetes, he could recognize that my case was different. So he was the one that mentioned that he thought I could be a type 1.5. And he didn't really explain what that meant. But at least I knew that I wasn't dealing with type 2 because my numbers were so high at the time. He had recommended that I start on metformin just to bring my numbers down, which actually is a treatment for type 2. And I've heard people with type 1 try metformin and it doesn't actually work. So if that's your situation, take a look at that. I also started on a strict keto diet, and then started regular exercise and started a protocol of supplements. And those supplements that I was taking were berberine, chromium picolinate, and alpha lipoic acid, which all work to help the body metabolize glucose. I did some research on metformin, and I decided at that time that I wanted to wait. I wanted to see if I could get my levels down with just, doing these other things. And thankfully I was. My numbers came down within a few weeks. My, morning fasting levels came down within a few weeks. And then I also did start working with an endocrinologist, understanding that this was, something that I really wanted an expert to be advising me. I wanted someone with that expertise. So the endocrinologist that I decided to see recommended that I get a sensor to be able to track my glucose levels throughout different times of the day, see what they were doing. He had me retest my A1C then in December of that year. So I tested my A1C at that, during that time with the chiropractor, and it had been like a 10 point something at that first, those first labs. So in December, it was down to a 5.2. And my endocrinologist was honestly shocked. And his recommendation was keep doing what you're doing. And he even said, you have non-diabetic numbers. However, in those same labs, he also tested my antibodies. And so up until this point, I thought, the chiropractor had mentioned I probably have type 1.5, but I didn't really know for certain what type I had. And so I thought that maybe if I was type 2, I could reverse it by doing what I was doing. But in those labs, the results came back, and the IA2 antibody and the GAD65 antibody were positive. I remember my doctor saying that because I have those antibodies, the diabetes progression could take months or it could be years, progressing so slowly that it never really progresses, and that I could live the rest of my life without any diabetes, essentially. I was really hoping for that. And so for about a year, I managed it naturally with supplements, with eating low carb. We went back to Lebanon after our sabbatical. I felt great. And I thought it might be this easy forever, and that I would be able to manage the diabetes through diet and supplements forever. Well, after October 7th, there was an increase in violence on the border of Lebanon and Israel, and we were recommended to evacuate at about the same time as the embassies. The embassy's non-essential personnel were evacuated. We left Lebanon thinking we'd be gone for a few weeks, and we ended up spending 6 weeks in Europe. And I just want to talk a little bit about this time in Europe. There were several things that caused an increase in stress. One was taking things day to day, not having a long-term plan. It's like every few days that we would reevaluate the situation and wonder, okay, are we going to go back? Okay, no, let's wait a few days. That was stressful. My husband and I we're both doing online school courses. My husband is in a master's program. And we're back for round 2 because mom life, and the kids are in bed now. And so I will continue where I left off. Yeah, so we basically left Lebanon thinking we would be gone for maybe a few weeks. Anyways, ended up being 6 weeks. And it was a really stressful 6 weeks. Every few days reevaluating whether or not we were going to go back to Lebanon. We were also in 5 different accommodations, just moving around way too much. It was a lot. It was really stressful. And, aside from all that, there was just like a really big emotional burden that I particularly felt, with just seeing all the devastation in Gaza and seeing the violence on Instagram and TikTok, and just seeing all the death. I was in a dark place. My mental health definitely took a hit, and at about week 4 or 5, I started to feel my eyesight going blurry again. And at that point, I was only, doing a finger prick every few weeks or so, just to make sure that my numbers were still, low and normal. And so sure enough, when my eyesight started to get blurry, I tested my glucose levels and they were in the 400s. And I remember testing over those days and just seeing numbers in the 400s and 500s and just thinking, oh no, we're here again, and not really knowing how to address it while we were in such instability. And so we did come back to the States. The effects of stress on diabetes are real, and I feel like that's not talked about as much, but stress does impact numbers. It does impact our bodies. It does impact our health. And so I think just the stress of that time, for whatever reason, kind of put me over the edge. Oh, another factor too is just the culmination of the perfect storm. So a few weeks before we evacuated Lebanon, I actually stopped breastfeeding my youngest child. And at that point, she was only nursing once a day. But I know that breastfeeding has an impact on metabolism. And so I do think that that very likely could have had an effect on, along with all these other things, on my glucose levels rising. So we went back to the States, came back to the States to spend holidays with family and have a long-term plan and work with my endocrinologist to get things in order. Um, and so when I finally got in to see my endocrinologist, my A1C was at a 10.8. And remember, just a year before that, exactly a year. So this was in December that I got labs done again. And exactly a year before that in December, I was at a 5.2, I think is what I said. And so another interesting fact, a thing that he tested for was my C peptide at that point, which was on the lower end. And that's an important test that shows how much insulin your body is producing. And so my insulin was on the lower end. So I know that I am still producing some insulin, but not enough. And so it could mean that I can work on getting my levels down and helping my body utilize that insulin more effectively. From my understanding, when your glucose is high for so long, your cells will kind of become stunned and not be able to utilize the insulin. And so and it can also stun, according to my understanding, the beta cells, so that even the beta cells that you have are also not producing the insulin that they could be producing. So my levels were high for too long. So they were in the 300s for about 6 months. At that appointment, my endocrinologist basically said, you're at the point where your body needs insulin, like the diabetes has progressed and you need to be on insulin therapy. He didn't think that, trying to go things naturally would be an option for right now. However, I was really hoping that I would still be able to manage it without insulin and manage it naturally. And so I scheduled an appointment with a nutritionist and I started a new protocol of supplements, and I waited. I was supposed to be on this protocol for about 2 months. Anyways, it was too long. It didn't work. Um, Another just horrible symptom was for 3 weeks over Christmas and New Year's. I had the worst yeast infection I have ever had in my life. I rarely get those. And um, I started off with trying all the natural remedies in the book. And then I went to Monistat 1. And when those didn't work, Monistat 1 plus a topical cream, that did not work. And I finally was able to get a recommendation for a homeopathic that finally worked. But yeah, I was really miserable for way too long. After trying this natural protocol and getting my labs done 3 months later, my A1C had gone up. It was a 10.9. And so at this point, I was really discouraged and just really felt like I was a failure. There was a lot to wrestle through. And as someone who believes that food can be medicine and that taking care of your body and eating right prevents disease, and also that like there are pharmaceutical companies that are greedy, and it's very possible that you're given medication that can lead to more complication that leads that leads to more medication. And I this is just where I was at that point, and I just could not imagine being dependent on a prescription from a pharmacy for the rest of my life. And that probably sounds ridiculous to a lot of people and very extreme, but maybe some of you can relate, and maybe some of you need to hear that you're not a failure. And yeah, it's great to be naturally minded, and natural remedies can be our go-to. They can be our first stop, but sometimes modern medicine can save our lives. And sometimes our bodies can't function without medication or insulin or whatever it is. And that's okay too. So if you're wrestling with that, like I did, just know that you're not alone, and that I give you permission if you need someone to give you permission. Thank goodness for both Eastern and Western medicine and the things that they bring, the benefits that they bring and the place that they have. Another thing that during this time was really hard, and that is outside comments and opinions that were really toxic. And if you know someone that has diabetes, please don't ask them or police their carb intake or their food choices or their numbers or their exercises. Um, you don't need to ask questions like, well, have you tried this? Or maybe if you tried that. Now, in all of this, I'm really grateful for how supportive my husband was and is. And if you know someone with diabetes, all you need to do is listen to them and show empathy, because you don't know what they're going through. The mental and emotional load of a health issue like this is a lot, and they don't need your judgment on top of that. So, no matter how confident you are that you would do things a certain way, if you were in their shoes, you're not in their shoes, and there's no possible way that you could understand or know what you really would do. So just feel free to keep comments and suggestions to yourself unless they ask you. And then in that case, feel free to share. Because chances are they probably thought about the thing that you're going to bring up. And so, anyways, back to my story. I finally came to the understanding that type 1.5 is type 1 diabetes, like I talked about earlier. I went through a period of just researching and really honing in on, okay, what exactly do I have? What is my body doing? What treatment does it need? And my body is in a place where it needs insulin. And so having such high glucose levels, I realized was going to do way more harm to my body than any damage that taking some insulin would do. So after having, several months of high glucose levels, I started insulin. And that's been a whole process. I explained in another video that my endocrinologist is starting me on slow acting insulin. For right now, I'm not on mealtime insulin. So that's a once a day injection in the evenings. Recommended that I start at 5 units a day for a week, and then increase by 2 units once a week until reaching a fasting glucose level of 150. So I started with 5 units, and I was super discouraged when I didn't see my fasting levels come down for days. They were still in the 300s. And so, I don't recommend this, but I'm just going to be honest. This is what I did. I read somewhere, I think it was maybe on the insulin box, that you can actually increase your levels every 3 days. And so and the reason I'm saying I don't recommend this is because I decided to do it quicker than my doctor recommended. Because I was just so tired of being tired of having high levels that wouldn't come down. So I started increasing it slightly, a bit quicker, still just by 2 units, but every 3 or so days. And so it's been about 4 weeks, and I'm taking 14 units a day. And this morning was the first morning that I was at 150, which was just crazy and huge and such a relief. And it felt like it took way too long to get there. And just another note, so 150 is not the goal. The goal is to be lower than that, but the way my doctor explained it was that once I get to 150, that my levels will continue to come down at that same insulin amount. So I'm gonna continue at 14 units and then hopefully continue to see it come down. So another really encouraging thing is that a couple of days ago, I finally felt a little bit of the brain fog starting to clear. I'm still tired, but I know that as my numbers do keep coming down, that I will start getting more energy back. And yeah, the brain fog is like one of the worst parts of it, because you just feel like you literally cannot think or function or plan anything. So to have some of that clear has just been huge. Like I finally feel like somewhat of a normal person again. So that's the story of my diagnosis and my journey with type 1 diabetes. Let me know if you have any questions or if there's something that you want me to talk about. I've been thinking about sharing about getting my children tested for type 1 diabetes antibodies, or maybe about parenting with a long-term illness. You let me know what would be helpful for you to hear. Leave that in the comments. And also send this to someone that you know that is thinking that they could have been misdiagnosed with type 2 diabetes. Maybe they're doing all the right things, but they aren't seeing their glucose levels improve. If they are looking for more information, send this to them and maybe they can get some of those tests done to see if it's in fact a type 1 diagnosis. And then lastly, please like this video and subscribe to my channel if this video was at all helpful for you. Thank you so much, and talk to you soon.